If you're like me, you probably spend more time in front of a computer or a screen than you would like to. And especially this time of year with the wind blowing and the pollen out, those eyes can get really red and dry and irritated and just annoying. And so this month we've been talking a lot about natural things that you can do that are effective in combating some of those gnarly allergy symptoms. Today specifically, I want to talk about colloidal silver. This is a new one to me in the last, I don't know, say 10 years, something I certainly wasn't raised with. It's something that you can purchase at anything from Sprouts to natural grocers, and it's a safe and effective natural way to reduce some of the irritation of the eyes. And so simply put, I would just take this colloidal silver. This is a Sovereign Silver brand. I'm sure there's multiple brands out there, but this is the one I've seen used the most. And I literally would just take a drop of this and place it into my eye and blink a few times. It really relieves some of the irritation of my eye. It's very safe. There's no burning or harsh chemicals in here. Totally safe. In fact, even my toddler has used something like this. So I hope this helps. Colloidal silver, effective for irritated eyes. And you're going to use this throughout the day as the eyes become, strained, irritated, red, maybe a little dry and crusty. I hope this helps. Dr. Joe Utash, Wellness Key Chiropractic.
Hey guys, this Mindful Monday, get outside. The outside environment is up to 100 times less toxic than the inside environment. So every chance that you can this week, whether it be in the morning, before worker activities, or afterwards, or at lunch, or going to get the mail, get outside, take some fresh breaths of air, and reduce your toxicity. I'm Dr. Utash, Wellness Key Chiropractic. Get outside.
Hey guys, Dr. Utash here, Wellness Key Chiropractic. Obviously, one of the common reasons people go see a chiropractor is for sciatica. This is obviously for both patients, myself, and everyone else out there alike. If you're having sciatica, most likely that's going to be coming from these nerves that come out the lumbar spine. They travel around the glutes, around the piriformis, and then eventually down the leg. In fact, some people with sciatica feel that pain all the way down into their feet. And so I want to show you a simple technique using a lacrosse ball, which is a high density ball, to actually work out some of the fascia, some of the muscles in through here in the glutes, in the glute medius, the piriformis, even some of the paraspinal muscles here that can give you some relief for that sciatica. Oftentimes the actual cause of that is a misalignment or a shift of these lumbar vertebrae called a subluxation. They pinch those nerves and cause that radiation down the leg. But in a pinch, this is a great technique that you can use to give yourself some relief. So you're going to take a ball and you're going to find an open space on the wall. And so you're actually going to be rubbing, and I'll demonstrate this in just a second, the ball along the paraspinal muscles. So we have the spine right here with the paraspinal muscles in through here, and you're going to kind of go up and down the wall, kind of like a bear scratching his back on a tree. You might make even some small circles, and you'll feel some of those nodules in there. You're just going to go gently and try to work some of those out. Again, you're going to be very careful not to actually get on the spine itself or on the pelvis. Right below the crest of the pelvis, oftentimes is an area of irritation for those nerves as they come out. And so working this ball along here, again, being careful not to get on the bone itself, on the sacrum itself, but you'll feel those little nodules, those areas of tension that you can work out as well. You're going to go down and then, of course, on the side as well. So a lot of people complain that side kind of wraps around into their hip. And so you can actually start working the ball, this lacrosse ball along the hip and along the side near the glute medius and through here. Again, this has helped a lot of people get a lot of relief from that sciatica. I'll demonstrate it here real quick. So you'll just take the ball, place it against the wall, kind of squat down a little bit, and you'll find those areas that you need to work. And again, just kind of like a bear scratching its back on the wall, you'll get right in there. And again, it's a great thing for breaking up some of those adhesions that can entrap the nerve, causing some of that radiation of pain. And then again, up a little higher in the lumbar spine. Certainly a great way to help with sciatica in a pinch. Of course, I would recommend going to a chiropractor, ultimately seeing, is there damage in that lumbar spine? Is the spine twisted or shifted, pinching those nerves, actually causing the sciatica, and really address it at its source. But as a quick fix technique, using a ball such as a lacrosse ball to work that out works really well. Again, Dr. Utash, Wellness Key Chiropractic, tips for helping with sciatic pain.
Hello! This week I want to talk to you about your schedule here in the office. Usually, for most people, we'll start you at a higher frequency. Remember, we talked about at the beginning at your first couple appointments the importance of coming in at that recommended frequency. If you're new to chiropractic care, you're having a lot of pain, you're having a lot of symptoms, it's very important that we're seeing you ideally 3 times a week for the first month. That super consistent motion in the joints that we're not seeing a lot of motion in to start, typically on the x-rays, that's going to help us get over the hump of the symptoms that you're having, and it will give all of us a very clear picture as to what you as an individual need to heal as quickly as possible here in our office. After the first month, we do that progress evaluation. The importance there is that we're going to now make it a lot more individual for you. If you're seeing significant progress in the first 11 or so adjustments, that's amazing. We'll probably have you come in 1 time a week if that's the case. If you still need a little extra, some room for improvement still to be made, we'll probably have you come in at that 2 times a week or even keep you at 3. So it's very important that you're sticking to those recommended frequencies as best as possible. If you ever need to alter your schedule, you have questions about what frequency you should be at, anything like that, please let Cherie know, let me know. We're happy and flexible to change things up whenever, if ever you need to. So make sure you're asking questions about your schedule and sticking to those frequencies that they recommend for you. Have a great week.
Sven, I told you, I can't watch Shrek 2 with you again. I'm not gonna do it again. No. 3rd time is not the charm, okay? Hey, I gotta go. I gotta do some exercises. All right, yeah. No. I'm hanging up now. Oh, hey guys. Just doing some wobble exercises here at the office after my adjustment and after my vibing over there. So, what are we doing here? Working on a range of motion. Ear to shoulder, shoulder to hip for this first one. 30 times is the recommendation here. So 1, 2, okay, counting like that. Or you can count to 15 if you want. 1, 2, 3, whatever works best for you. This is proper spinal hygiene for us, okay? We work on oral hygiene twice a day, we should be. Same thing here, spinal hygiene twice a day. Whatever that looks like when you wake up in the morning, and then before you go to bed, or a couple breaks throughout the day, taking 60 seconds, 2 minutes to get these wobble exercises in. Increasing range of motion, like I said, also helping to hydrate the spine, hydrate the discs in between the vertebrae. It also helps to break up any scar tissue and adhesions forming on the spine, which many of us have. So there's that one, side to side. The next one, opening up, bringing the shoulders back, chin up to the ceiling, arching that back, and then closing up, chin to chest, rolling forward the shoulders, hunching forward, tucking the tailbone. 30 of those. 1, 2, 3, 4, up to 30. Last one, I promise. Bringing the arms up like so, whichever's more comfortable, and twisting to the side, and then looking behind us, trying to find the same landmark each time. As it gets easier, increasing as we go. If it is, now I will say, if it is painful, just go to the discomfort, not into the pain. Let's do no harm. Dr. B here, Wellness Key Chiropractic. See you real soon.
Hey guys, Dr. Utash here. This is Therapeutic Thursday. I'm talking to the people here with shoulder issues, shoulder pain, lack of range of motion, tight traps, maybe a person that's been sniffing computers for hours this week. This is a great exercise for you. So you're gonna get on your side, on the floor, in bed, arms straight up to the best of your ability, and you're gonna make little circles. You might wanna support the head with a pillow, but think of 10, 15, 20, even upwards of 30 circles. And then come back up. shake it out, rest for 30 seconds, and do it again 2 more times. This sideline shoulder circles is a great way to get some range of motion and get that shoulder and get all the supporting muscles actually moving. Try it this week.
Yeah, you should totally come in. Yeah. Super, well, so actually, so if you tell them that I referred you in, then it'll be at our expense. I know that you're dealing with a lot of back pain and neck pain. Dr. Utash and Dr. B are awesome, and they can definitely help you with that. Just call them, tell them that you're having pain. They can get you set up for a consultation, see what's going on in there, get some x-rays. They're gonna wanna see what's going on in there so they can get you a proper adjustment, and then we'll bring you back, and then that'll be all at their expense, just because I referred you in. Isn't that awesome? Yeah. No, you should call them and see what they have available. They have availability all the time. Well, almost all the time. Yeah. Cool. Do you want the phone number? Awesome. Okay. It's 520-797-6683. Yeah, and they're off of First Avenue. Cool. Okay. Promise you're gonna call? Okay, good. I'm so proud of you. All right. Awesome. Bye. Oh, hey guys. So I was just talking to my friend there, experiencing some pain. Told her she should come in, talk to one of the doctors. Let's get her set up. Also, some really cool stuff, just with my friends here. Seen a lot of improvement with some patients that have been coming in. Just a couple things I just wanted to note. Let me just, not taste good. So, from one of our patients, less chronic pain and more stamina. That's so awesome, right? Here's another thing. Stop taking a lot of Advil, which they were taking on a daily basis. Reduce that down immensely, and also some muscle relaxers. That is absolutely incredible. If you don't think that's awesome, I don't know what's going on. It's awesome. That's just one of them. Let's do another one. Okay. Pain has dramatically changed and the neck feels different. That's super awesome. They've seen improvement in their respiratory, their digestive system, feeling like their immune system is getting better, and their mood and their stress is improving. That's super awesome, especially me on a personal level. I deal with anxiety, and I have also seen improvement in my anxiety since being here. So, that doesn't tell you should be coming in, referring some friends in so we can help them out as well. I don't know what does. I hope you have a good week.
Hey guys, I know we all have these computers at home or cell phones. I just want to encourage you guys, if you're on social media, give us a like, give us a share. If you have a friend in need, share a video. If you've not been to our website, wellnesskeychiro.com, we have multiple series on there, whether it be allergies or low back pain or chiropractic philosophy. They're all on there, and they're short little videos that you might want to send your friends or loved ones that might be suffering with a certain thing on how to handle some of these conditions naturally. We'd love to help you. We'd love to help your friends and family. Thank you for checking us out.
Hey guys, Dr. Joe Utash here, Wellness Key Chiropractic. A lot of our patients come in from various different sources. A lot of them are from referral, and we certainly appreciate that. The question of the week this week is how do you find a great chiropractor, right? And so I know a lot of you guys might have family outside of Tucson, different parts of the country, even the world, and how do you go about finding a great chiropractor? First of all, I'd love to help. If you're a patient here, we can look it up, and I have colleagues that train the same way that we do, and that their office is running the same way that we do around the country. I'd be happy to help. But number two is you want to find someone that's passionate about what they do, right? Whether it's a guy who's servicing your car, the person who's styling and cutting your hair, you want someone who loves what they're doing, and that should just show through. So that's number one. Number two is the team should know what subluxation is. Subluxation is when is the stress in the nervous system due to that misalignment or fixation of the spine. If the team doesn't know what that is, then you're probably heading towards the wrong office. So make sure that the team, when you call in, knows what a subluxation is. Number three,
at the very beginning, there should be some sort of an exam. I would prefer x-rays as well, right? So you don't want to guess, you want to see what's going on underneath the skin. I've seen some crazy things over the hundreds if not thousands of x-rays that I've taken, and you just want to know, right? And so sometimes people forget to mention the surgery that they had in their low back 10 years ago, right? I get it, things happen, but I want to see to make sure that it's 100% safe where and how to adjust that individual. And then you want to find someone who's continually training, right? Who's up to date on the latest information, who's current, right? Who's really, it's not just a job, it's really what they're doing with their passion, what their service is. And lastly, you don't want to eat in an empty restaurant, right? If you go to a place and it's dead empty, and you've been there a couple of times and there's just no one there, you got to wonder why, right? And so you want to go to a place where people are smiling, they're getting results. There should be some testimonials there, right? And so never eat in an empty restaurant. Same thing is true for a chiropractor. You want to go to a place, if the person is really good, they should be helping lots of people, right? Because that good news will eventually travel. So I hope that helps. Dr. Joe Utash, Wellness Key Chiropractic. How do you find a great chiropractor?
Hey guys, Dr. Joe Utash here, Wellness Key Chiropractic. Today I want to talk about subluxation. So subluxation is a term in which we're talking about the spine, the central nervous system, and a term that you'll often hear at a chiropractic's office. So subluxation is when that spine either gets stuck or it gets misaligned. That interferes with that signal from the brain down the spinal cord and out those nerves going to vital organs. So in your neck, let's say maybe after a car accident or maybe after sleeping in a weird position, that can irritate those nerves in your lower neck, going into your shoulder, causing shoulder pain, neck pain, maybe headaches, and even as far as going into the hand, causing numbness and tingling. Over time, that whole joint complex can actually lock up, and that can choke off nerve supply to things like your thyroid, glands of your face, mucous membrane. So we may see things like allergies, sinus issues, maybe hypo or hyperthyroidism. So in the lower back, when you have subluxation, subluxation again is where that spine gets stuck or misaligned. That can irritate nerves here, block that communication from the brain down the spinal cord, out those nerves to things like your lower back, your butt, down into your leg. If it's been there for an extended period of time, this also goes to your colon, reproductive system. So things like infertility, constipation, IBS become common symptoms with long-standing subluxation. So if I break down that word subluxation, sub means less than, so or below. Lux, it's Latin for light. So you have less than normal juice or light coming from the brain, down the spinal cord, and out those nerves to those organs. So when that communication is disrupted, right? When you have an unhealthy spine, you're gonna have an unhealthy organ, muscle, cell, or tissue. Again, Dr. Joe Utash, Wellness Key Chiropractic. What is subluxation?